Claudia.
Hi, Danny.
I've been asked to set up a syringe driver for Diane Kura. Would you better help me set one up?
Yeah, sure. Have you done one before?
No, I haven't.
Okay. Well, how about I take you through it this time, and then perhaps tomorrow we can go through, but you can lead on it then.
Okay, great.
Okay, great. Cool. We'll go into the drug cupboard. So Danny, the first thing we need to do is just check Diane's medication order. So she's been ordered for morphine sulfate 30 milligrams over 24 hours, metoclopramide 30 milligrams over 24 hours, midazolam 10 milligrams over 24 hours.
Okay.
So we need to make sure we get all of those medications, and then I'll show you how to make them up. So morphine sulfate and the midazolam are both kept in the secure drug cupboard, so we'll just get them out and check them out. Have you checked out medications before?
No, I haven't.
Okay, well we'll do that together as well. So first of all, you basically look at the front of the book to see what page the drugs are recorded on.
Yep.
So you can see here midazolam, or the other name for it is Hypnoval, is on page 19.
Yep.
So we just go through to page 19, and what we can see is that there should be 2 in the cupboard at this time. So if we just have a look, that's right, so there's 2 there. And today, what's the date today? It's the 1st of May, isn't it?
Yes.
So we just have to sign it out, and the time is 1 o'clock. We're going to sign out for Diane Kura, and she's been ordered 10 milligrams.
Yep.
And now that we take 1 ampule, we just have a look. There's Hypnoval or midazolam. There's 50 milligrams in 10 mils. I'll just check if that's the right one we want to take. That one is codeine phosphate. They sometimes have other strengths, but that's okay, so we'll use that one.
Okay.
But there's 50 milligrams there, and she's only ordered 10, so we're going to have to discard 40 milligrams of that.
Yep.
Okay, so we'll discard 40 milligrams, and that just leaves 1 left in the cupboard, and then we sign for that. It's been ordered by Dr. Brown, and we just write the amount that we've also discarded, just to be very clear with these medications, and you also sign for that. So we'll put this one back into the cupboard, and then the next drug we're wanting is the morphine sulfate. Again, if we look to the front, morphine is on page 27, which is here, so there should be 3 in the cupboard.
Yep.
We'll just have a look at what this is. So that's the morphine sulfate. There's 1, 2, 3. She's been ordered 30 milligrams, and this is morphine sulfate 30 milligrams per mil, and it expires in 2016.
Yep.
So again, we'll take 1 ampule, and this time she'll be having the entire ampule.
Yep.
1300, Diane Kura. We're giving the 30 milligrams. There's 2 left that'll go back into the cupboard, and again ordered by Dr. Brown. So if you could just co-sign that as well for me. So we've now got this medication. The metoclopramide's just in our normal stock press, so we'll go and find that there, and then I'll show you how to set it up. Okay,
Great, thank you.
Okay, just make sure we lock this up too. Okay, so when you're putting together a syringe driver, there's actually quite a lot of equipment that you need. So I'll just talk you through everything that we've got here at the moment. Importantly, you always have to be led by the medication chart and making sure that everything is accurately documented on that, both in relation to what medications we're giving, but also once we've set it up that we sign for having administered this syringe driver, started it. There's also a syringe driver like assessment chart that I'll show you that goes through how to check the subcutaneous site that you're using, but also making sure that the pump is working as we want it to.
Okay.
The pump we use here is a Nicky T34. That's what it's called. It's quite a small pump. And basically we will put the 20 ml syringe into that, and the pump will slowly push the barrel forward over the 24 hours, and that's how the medication is delivered.
Okay.
In addition to that, we need a a label saying exactly what is within that syringe so that anybody coming along knows what's being delivered. We need an op site to hold the subcutaneous butterfly in place. This is the safety intima we use, or the butterfly that we put in place for the delivery of the medication. So this does have the needle on the end that goes into the patient, but once you actually pull the stylet out, it means that you don't have any metal within the patient. It's actually only plastic, which is much more comfortable for the patient, because this can stay in place for several days. We also have an extension tubing, which is just gives so that there's some space for the patient. If they move, it's not tugging on this little safety intima. Now, you then need syringes for every type of medication you're making up, so that you can be very precise with the amount that you're pulling back. So for instance, we checked this morphine out of the cupboard just not long ago, and we know we have to give 1 ml. We want to pull back 1 ml in this syringe and know exactly that there's 1 ml of medication there, rather than using the 20 ml syringe, which is less exact. Okay, so you've also got a small syringe for the midazolam, and then another syringe to pull up the Maxilon. So we'll be pulling up all of these medications separately, and then we'll actually inject them all into this syringe, and then you will know the exact medication combination is within that syringe. Once we've got the combined medication, we'll then we'll prime this line and prime the safety intima and take this to Diane and actually insert it into her. One other thing I should mention is you do need some water for injection. You know the syringe driver compatibility chart that we looked at earlier? We saw that in that chart let us know that midazolam, morphine and Maxilon are all compatible, but we know we need to add a little bit of diluent, and for the best diluent to use for that combination of medications is water for injection. So we've got that as well. So that basically we're set up. We've also got a sharps container here as well to use. So I do this in quite a systematic way. It's really important just to be very careful that you're getting the exact drug amounts correct. So as I said before, I've got a tray for the morphine, the midazolam and the Maxilon. So as we go through, I'll just get you to check the medication again with me, and we'll pull back what we need. So this is morphine sulfate injection, 30 milligrams per mil, and expires in 2016. We know the order is asking for 30 milligrams, so we need the 1 ml. Opening a glass ampule, I always use an Alco wipe over the top, just to help so that the glass doesn't shatter or anything to me. So just go, should be easier than that. There we go. Now all of the work we're doing here, we want to do, you know, we've just washed our hands, but we want to still do everything with the no touch technique. So you can actually leave the rubbish just off to the side so that it doesn't become too crowded in your trays. So you've got your needle on there. Now normally you would never resheath needles, but what you do want to do is maintain sterility throughout this procedure. So I actually do put the cap back on. So here's the 1 ml. We just need to pull back 1 ml exactly. And if there is any excess, with this, I just sort of squirt it back into the ampule. But obviously this ampule has mainly the 1 ml because we knew it was 30 milligrams in 1 ml. I do put the lid back on, but just make sure that in general practice you don't resheath needles. This, however, just means that the no touch technique has been maintained and that is still a sterile surface. So then we also want to pull up the midazolam. So it's the same sort of process. Basically we want to check the medication first. So this is midazolam, 50 milligrams in 10 mils. And it expires in 2014, December 2014. So 50 milligrams in 10 mils, if we think about it, if we do a quick drug calculation, do you know how many mils we'd be pulling out to actually have 10 milligrams?
So you would need 2 mils to get out the 10 milligrams.
That's right. So it's 1/5. So we know we want 10 milligrams. There's 50 milligrams in here, so we want 1/5 of the 10 mils or 2 mils. So it's always important to get those drug calculations really clear as well. Again, we just open it. When did you start working on the ward?
about a week ago.
Okay.
Yeah.
Yeah. There's a lot to learn, isn't there?
Yeah.
Okay, so you've done the same thing with your needle, and we remember we need to pull back 2 mils. So there's a little bit of air there, so I just pull a little bit more so that you know that you can actually then pull it up to 2 mils.
Okay.
There's the 2 mils, exactly there. Remember in the medication book we wrote we discarded the 40 milligrams as well, so we need to discard this together, and you need to be able to see me do that.
Okay.
So again, being careful with the resheathing. So the final drug that we've got is also the metoclopramide. This is the one we took from the stock cupboard.
Yep.
So just to double check it again, there's the Maxilon 10 milligrams in 2 mils,
Yep.
expires in 2016. Maxilon 10 milligrams in 2 mils expires in 2016. And again, Maxilon 10 milligrams in 2 mils expiring in 2016. We know the order is asking for 30 milligrams, so we need to use all of that.
Yep.
Which actually will become 6 mils in total. Now these ones have the screw top, so we can just literally open up our syringe. And we just twist it onto the top and make sure we pull back the full 2 mils. Just hold the barrel when you're trying to take this off, because the suction otherwise will pull the medication back in.
Okay.
And again, so we do the same thing. So we're taking all of that medication, just get rid of some of the air or you won't be able to pull back. And here's the final one. Get rid of any air bubbles. And we'll just take this up to 6 mils. So there's a little bit extra, so we just get rid of that.
Okay.
Okay, and then just pop this needle on to keep the end clean, like that. So now you've got all the medications, and I quite like having them in separate trays so you know exactly what you're injecting into the bigger syringe. So this is now our 20 ml syringe, and this is going to be where the combination of medications will be. I'll just open this one up. So it's really what you do is simply pull the plunger back so that you can actually inject the medication that you've got here into the syringe.
Okay.
Okay?
Yeah.
So the one you've got the largest amount of volume is your Maxilon.
Yep.
So you can just put that straight inside and just inject it in. So you now know that there's 30 milligrams of Maxilon within that syringe.
Yep.
Now you wouldn't resheath, you don't need to, because that's not going to be used again. Now we're adding the midazolam, which is 10 milligrams. So again, we just add that in there. That's the 2 mils. And finally we have to add in the morphine. So we now know this syringe has got those 3 medications as ordered.
Yep.
What we do want to do is just dilute the medication a little bit so that the subcutaneous tissue doesn't get too inflamed.
Okay.
So what we'll do is just pull this up a little bit. Oops, there we go. Because we're just going to add some water for injection now and pull it back to the 20 mils. Oops, sorry, gave you a spray there. Now, we want to be careful to not let this medication go into the water, so you've got to be very careful to hold the barrel at the bottom. Okay, so you're going to pull out most of that liquid like that, and just see whether you've got the full 20 mils. And we do there actually, okay?
Yep.
Okay, so the next thing we're going to do is actually prime the line, which is this one. And now we know these have all been used. We still keep them handy, but we'll start to use this final kidney dish here, which is what we'll take to Diane.
Yep.
It's great we've got the pen in there. That's actually to help add the date on
Yep.
top of the op site so that we know what date this was actually inserted. So we open up the extension line. And we just add that on, and we're literally just going to, oops, I think I opened it in a way to give it a knot. So we'll just get rid of that.
Quite a few knots.
Yeah. Just one more. But you know it's safe to do this because you've actually got the cap on still, which is keeping it clean.
Yeah.
Okay, so now you're just going to push the liquid through so that you can see it come through to the end. You can see it running through the actual, so I go quite slowly so you can watch it the whole way through. And there it is there.
Yep.
Okay, so now you can pop that there knowing that that's primed. The next thing you're wanting to prime is the actual safety intimer as well. So we open this up. One of the first things I do with the safety intimer is just take off this little white clip. It's not really needed, and it just sits against people's skin and is uncomfortable for them.
Yeah.
So this white section here is actually holding on to the metal part that you'll pull back. You want to actually connect the extension line with this side line here.
Okay.
Again, you're doing it with a no-touch technique. So you take this lid off and this little bit off, and you pop it inside like that. So twist it on quite firmly, but not over, you know, don't overdo it. You don't want to crack the plastic.
Yep.
But again, you then just need to see it come through to the end like that.
Yep.
Now, because we're trying to run the 20 mils over 24 hours, we've actually used some of that 20 mils in just priming the line. So today when we started at just after 1 o'clock, it won't take quite the full 24 hours because there's slightly less volume to pass through. So tomorrow we'll probably finish about an hour early, and that's normal. But tomorrow, if the line's running really well, you simply add another combination syringe and it will be made up to the full volume and take 24 hours to go through, if that makes sense.
Yep.
So what we do now is just take this over to Diane. She's aware that we're putting in a syringe driver today, and she's you know, aware that that's going to be done shortly. So we've got the syringe driver, the label, the op site, and the medication made up, and we certainly take the drug chart with us as well. Okay. Okay, so hi Diane, it's Claudia here. We're just going to put your syringe driver in, just in your upper arm here. I've got Danny here helping me as well. I'm just going to check your armband.
So we have Diane Kura.
Yep.
Her MRN is 131446.
Yep.
Date of birth 5th of the 2nd, 65.
Yep. Great. Okay.
And doctor's
Dr. Brown. Great. Okay. So just to remind us, this is the actual syringe with the combination of the 3 medications ordered that's going to go over the 24 hours. So we'll insert it into Diane, and then we'll set it up on the pump, and then she'll be right to go. Okay, so any subcutaneous injection goes at 45 to 90 degrees into the person. So with Diane, we'll probably put it at about the 45 degrees, I would say. Sometimes if someone's very, very thin or very, very obese, that's when you might change the actual level of the injection that you use. Okay. So you just clean the area with an Alco wipe, so from the inside out, like that. And you just explain to the patient there'll be a slight prick as we actually insert the needle. So we just get it all out here like this. Keeps getting all tangled today, doesn't it? But that's okay. Now with these safety intimers, if you've not put one in before, you actually want to grab, see the beveled space there? You want to have that sitting against the skin. Okay. So really you hold the beveled part with your hands, and that will guide how the actual needle will go in. So we'll just pop that there. Okay, Diane, you're just going to feel a slight prick. You're going in at 45 to 90 degrees, like that. And then you just want to hold it in place. And that's when you're going to you're holding it quite firmly, and you're going to pull back on this white thing to pull out the actual metal. Okay, so that's gone now. Now what we want to do is straight away secure this in for Diane. So that will just sit like that. here's just a small opsite. So we'll just pop that over the top like that. And then just pull back. Okay, and there it's done. Now we just will now load this syringe into the driver, and that's when we can also add the label to explain to everyone what's there for Diane.
Yep.